Hi everyone. For this week's flashcard presentation, I chose the disease process of endocarditis. So I'll just jump right in. Endocarditis is a life-threatening disease involving inflammation surrounding the heart. The pathophysiology, most of the time, we'll get there, is usually a fungi or a common bacteria that enters the bloodstream through a various portal of entry. This could be orally, due to poor dentation and poor dental hygiene, ingesting a bacteria via the gut, or by means of injecting the bacteria via a dirty needle, or otherwise an implanted catheter. This could be like a long-term catheter, such as a dialysis catheter. I didn't realize that there are two different types of endocarditis. I think most of us know of this type. Ineffective endocarditis is the one that kind of seems to be the most popular of the two. And this is when from a various point of entry bacteria can enter the bloodstream, and they colonize foreign material, which if you have an implanted pacemaker, prosthetic valve, or a defibrillator, it can colonize onto such material. Or if your heart was previously weakened due to predisposed structural abnormalities, or if you had weakened endocardium, then that's a place where the bacteria can then colonize and grow. Ineffective endocarditis can affect 30 to 100 out of a million patients. So non-ineffective endocarditis, which is I find really interesting, I didn't realize this was part of the presentation, is diagnosed when there is endocarditis present. However, the blood culture is negative and doesn't grow anything. So that makes it seem as though there's no bug. So where is this coming from? And essentially, it's from other disease processes and rare pathologies, such as, for example, systemic lupus erythematosus, or metastatic endocarditis, Behçet's disease, and hypereosinophilic disease. So these can all cause endocarditis without the presence of a bacteria or a fungi. So that's extremely interesting. I didn't realize. The most common pathogens in ineffective endocarditis are streptococci, group P streptococci, staphylococci, enterococci, and these bugs essentially account for 85% of the episodes causing endocarditis. Move along right here. Risk factors for endocarditis include old age. Older individuals are more at risk over the age of 60 of developing endocarditis or getting endocarditis. If you have an artificial valve, this is always a risk because you have a foreign material within your heart, and if a bacteria then enters your system, it's more likely to colonize that foreign material. If you have damaged heart valves, such as an infection, rheumatic fever, or scarring to the valves, these are more prone to an increase of infection. Congenital heart defects. So if you had structural abnormalities at birth and you are and bacteria enters your bloodstream, you're at a much greater risk of developing endocarditis. Same goes for any implanted heart device. If you have had endocarditis at one point in your life, you're more likely to get endocarditis again. If you're use illegal IV drugs, you're at a much greater risk of being diagnosed with endocarditis because you are using needles, and if those needles are not clean and they are dirty, they can be contaminated and easily enter the body. Poor dental health. I've seen it in my practice, which is so really interesting. Gotta keep up with good dental care, because if you don't floss and you have really poor hygiene, bacteria can grow in your gums and that can enter the bloodstream that way. So just another reminder to floss. And then long-term catheter care. So we see this with people that need a PICC line for a long period of time if they're receiving antibiotics, or a dialysis catheter, or patients that need to be dialyzed. Those are also foreign objects within the body, thus a greater risk of bacteria being able to enter and inflame the heart. Here's a picture provided by the Mayo Clinic, and this is the damaged valve with bacteria growth. So you'll see that right here. It looks kind of like plaque, and that's what was determined to be vegetation within the valves. And then we move down to signs and symptoms. So common signs and symptoms of endocarditis are joint aches, muscle aches, chest pain when you breathe, fatigue, presents more like flu-like symptoms, fevers, chills, night sweats, shortness of breath. You're going to see swelling to the legs and feet. That's probably just due to poor perfusion and regurgitation. And then upon auscultation, you might hear a change in your heart, maybe a new murmur that wasn't there prior. Some less common symptoms are listed here, which is unexplained weight loss, blood in the urine, spleen tenderness, red spots on the soles of the feet or palms of the hands. That I find really interesting. I've never seen that. And petechiae. Let's move down. And finally, diagnostic blood testing. Well, it really depends if you have ineffective endocarditis or non-ineffective endocarditis. However, ineffective endocarditis is far more common than non-ineffective endocarditis, so a blood culture test will determine what kind of bacteria is actively growing in the blood and thus causing inflammation and vegetation on the heart. Echocardiogram is usually up next if that's suspected. The TEE is used to assess vegetation and on the heart chambers and the valves. I think that most of the time, it really depends on the scenario, that they'll want to treat with antibiotics first before going in to do a TEE, but I think it depends on the patient presentation. A complete blood count is also done and kind of standard for all our patients, but to assess for an elevated white blood cell count, just to assign sign of infection and inflammation. 4, they'll do an EKG, so again, assess the rhythm of the heart and how the endocarditis has basically affected the electrical activity within the heart. A chest x-ray is then proceeded if they do suspect endocarditis. They're going to want to see if it's spread to anywhere else, including your lungs, and then possibly an MRI as well to see if the infection has spread to the brain, chest, or other parts of the body. Here are my references below. That is it. Have a wonderful, safe week. Bye.